that low flow. COPD, how can I explain it? I'll take it frame by frame it, to have you all jump and shout and saying it. C for chronic obstructive, P for pulmonary. The last D, well, that's not that simple. Sort of like another way to call a respiratory condition. There's 5 diseases that are missing here. You get it on occasion if respiration isn't gaming. It seems I gotta start to explain it. Bust it. You ever had some breathing feeling up and shallow? Catch your breath, your chest rise and even yo. You get home wait a day and still not better though. The rationale is ineffective airway, yo. It's not in front to F to the R to the O to the N to the T. It's just that breathing is obstructed. It's COPD, not enough air is what you're getting. There's no room for airway, there's just room to hit it. How many patients out there know just what I'm getting at? Who think it's wrong cause you was wheezing with a horror gag? Well, if you do, that's COPD and you're not down with it. But if you don't, here's your membership. Who's got COPD? You got trouble breathing? You got caught up wheezing? Who's got COPD? You got COPD? You got trouble breathing? Got caught up wheezing? You got COPD.
Are you okay? No. You okay?
Ow.
We gotta get her up. Okay.
Come on, my chest hurts, guys. Oh.
Are you okay? Here's some
Mabel,
water.
Mabel. Ow.
Your pulse is racing, Mabel. Mabel, are you sure you're not just gassy?
No.
What are you feeling?
It hurts on one side.
You just have anxiety.
No,
and
I'm
what?
not.
And what? It
Mabel,
just hurts?
I'm having a hard time breathing.
Mabel, just eat some chips. You'll be fine. You'll be fine. Just eat them. Eat some. Have some water.
I don't know. Allie?
Wait, Allie, don't you go to nursing school?
I do. I happen to go to ACC, and I'm always ready with my equipment. Let me check your vitals, Mabel.
She's not faking it, huh? No, I guess she's serious.
Oh.
Looks like she's sweating.
I think we need to call the ambulance, guys.
Mabel.
I think she needs some more tests.
Are you okay?
I'm not. It hurts. My
I'll
chest
call
hurts on
911.
one
I think she
side.
needs a chest x-ray and some ABGs.
Audrey, get on it. Call 911. I'm calling right now. Okay, guys. Ambulance is on their way. They're coming, Mabel. It's gonna be okay. Don't worry, Mabel.
Ow.
Oh my gosh, Mabel, you're sweating so much.
I feel like I'm gonna die. It hurts so much. Ow.
Your chest is
Ow.
uneven. Only your left side is moving.
Ow.
Don't worry, Mabel. They're almost on their way. We called 911.
Ow.
Mabel!
No, Mabel.
Oh my gosh, she passed out, guys.
Ambulance is
I
coming,
think
Mabel.
the ambulance is here,
Oh my
Mabel.
gosh.
Oh my gosh.
Hi, Mabel. My name is Dr. Imai. Do you know why you've come in today?
No, what happened?
We did a chest x-ray on you, and you have a presence of a pneumothorax. We also did another test on you, the ABG, which is the arterial blood gases, and that one showed that your pH and your oxygen was really low, but your carbon dioxide was really high.
Am I gonna die?
No, you won't, but we can show you a video on what happened. Roll the video.
During normal respiration, the lungs expand and contract within the chest cavity. The lungs are encased by 2 layers of tissue, similar to a fist that has been pushed into a balloon. The space between the layers, called the pleural cavity, is lubricated so that the lungs can slide comfortably across the chest wall. If air enters the space, it is referred to as a pneumothorax. One type of pneumothorax, called a traumatic pneumothorax, can be caused by injury to the chest. A blunt or penetrating chest injury can cause a small tear on the surface of the lung. allowing air to enter the pleural cavity and to become trapped. The pocket of air produces excessive pressure on the lung, causing it to collapse. A spontaneous pneumothorax occurs without injury as a result of certain lung diseases, such as asthma, emphysema, or COPD. Small air-filled sacs called blebs can form on the lungs. If the blebs rupture, they can release air into the pleural cavity. Pressure from the trapped air causes the lung to collapse. However, a spontaneous pneumothorax can also develop in a person with no obvious risk factors or disease. This condition is more common in smokers and in men between the ages of 20 and 40. A tension pneumothorax is a serious complication that can develop with any pneumothorax. If the pocket of trapped air cannot escape, it continues to grow. The increased pressure in the pleural cavity can push the heart and major blood vessels to the other side of the chest. When this shift takes place, it causes a significant drop in blood pressure. This is a life-threatening condition that requires immediate medical attention.
Am I gonna die? Where do I go from here? What do I have to do?
We saved your life because you had an air pocket in your lung, which is what caused it to collapse. So we actually videotaped your surgery, so if you'd like to see it, we can show it to you.
Okay.
Roll the clip.
Okay, when we talk about pneumothorax, we're talking about air getting into the pleural space. So here's our lungs. We have our left lung, our right lung, and surrounding that lung we have what's called the pleura. Okay, the pleura is a little protective covering that surrounds our lungs. Now that's a great thing. It helps protect our lungs, it helps our heart expand, it helps everything with respirations to protection and everything. But what can happen is our lungs can develop these little blebs on them. These blebs are little tiny like vesicles of air, and what can happen with those blebs is they can rupture, okay? And once they rupture, you can imagine that air comes rushing out of our lung and it begins to fill that pleural space. Now there's nowhere really for that air to go other than into this pleural cavity. So what will happen is the air begins to compress this lung down, okay? The lung becomes compressed as this space fills with air, okay? So that's what we call a collapsed lung, is this air filling up in here. When it can't escape, it can't get out of this pleural space, so it pushes the lung in, okay? That's a pneumothorax. Now what do we do with a patient who has a pneumothorax? As you can imagine, it can cause a lot of anxiety, it can cause a lot of pain. So what the physician can do is they can cut a little slice, a little incision here, and they can insert a chest tube, okay? So the tube will go in right to that where that air is collecting within the pleural space, and it will allow that air to come out, okay? Now when the physician enters that, it really does, it sounds almost like opening a can of soda or something. As they enter that space, and to know that they're in, you kind of get a sound of like cracking open a soda, tss, and that's that air rushing out, okay? So as we allow that air to come out, the lung tissue then begins to expand again as that air escapes, and it releases that pressure that it has on the lung, okay?
Hey Mabel.
Hi, Mabel.
Came to visit you. See how you're doing. Brought you some chips. How are you feeling? What did they say?
They said I had a pneumothorax because I had COPD and severe coughing that led to pneumothorax, and it's
I've heard about pneumothorax.
Yeah,
It's
they
when you
said-
have the air pocket in your lung, right?
and then my lung collapsed. That's why. And they taught me how to do what I'm doing right now.
Oh, what are you doing?
Pursed lip breathing.
Pursed lip breathing? Oh, what
Yeah.
is that?
Like you inhale through your nose and then you exhale through pursed lips.
Is it fat? Do I exhale fast?
No.
Slow?
Slowly.
Oh, okay.
Like this. Try it.
Okay, that's kind of cool. Okay, thank you for teaching us.
Yeah.
Now you guys try.
Why don't you do it?
Sam!
Jerry.
Come on, Aldo. I know you can do that better.
JJ. Do it.
Cool, thank you.